Hi, I'm Jenny from Life Cycle Physiotherapy. Today we're talking about doing pelvic floor exercises in pregnancy and also the knack, which is that ability to coordinate your pelvic floor with function. Most women know they're meant to be doing pelvic floor exercises in pregnancy, but some women feel it's difficult to do these in pregnancy. So a quick anatomy review. Your pelvic floor muscles sit in the pelvis. Here is the pubic bone, which is that bone at the front of the pelvis, and the pelvic floor muscles go underneath and attach to your tailbone at the back, which is right back here, and then out to almost where your sit bones are on the sides. So they cover that whole saddle region if you were sitting on a horse. When you're pulling in the pelvic floor, it should feel like a squeeze and lift, like you're trying to stop yourself passing wind or having a wee. Now, some women find that difficult to do in pregnancy because the weight of the baby down on the pelvic floor can make it hard to feel like they're engaging those muscles, particularly when they're sitting or standing. So 2 quick ideas with how to do these in pregnancy. First of all, if you lean forward on a table and let the weight of your belly come forward a bit and then try pulling in your pelvic floor, sometimes you can get a bit more of an idea with that because you can feel that squeeze and lift up in that saddle region, but then the weight of the belly is forward on the tummy rather than being down on the pelvic floor. Another idea in pregnancy is to try these exercises on all fours. So in an all fours position, again, the weight of the belly comes forward into the tummy, and when you try and squeeze and lift with your pelvic floor, you can feel that draw up between your sit bones, and sometimes that can feel more effective. The knack is your ability to coordinate your pelvic floor with function. For example, a cough or a sneeze, but with other things as well. So some women can actually have a very good pelvic floor contraction, but they cannot coordinate their pelvic floor with function. So a few ideas with the knack. One is to practice with a cough. Again, you could resume your forward lean position if you're doing this in pregnancy. Get the pelvic floor muscles going, and then holding that contraction, have a cough. And then let go. So it's a squeeze and lift with your pelvic floor, holding it in, cough, and then let go of the pelvic floor. You could do one cough or you could do several coughs in a row. Another idea with your pelvic floor muscles with the knack is to practice moving from sitting to standing or into a squat position. So with a chair behind you, you may like to start by pulling in your pelvic floor and sitting. As you stand up, hold on to that contraction and then let go once you're up. Or you could do it from standing. So you could pull in your pelvic floor, sit your bottom back into that chair, and then let go once you're seated. So those are some ideas with sitting to standing, but you could also use that idea to practice a squat down, because some women find as they bend, they lose that pelvic floor contraction. So from a standing position with a chair behind you, practice pulling in that pelvic floor, hold it in as you drop the bottom back towards the chair, and then standing back up again. And again, pull in your pelvic floor, hold that in, drop your bottom back towards the chair, and then stand back up. And that's it. So there are some ideas for practicing pelvic floor muscle exercises in pregnancy and also practicing the knack, that coordination of the pelvic floor with function. Thank you.